everyone, welcome to Thrive with Dr. Varsha. Today's video is going to be about a curriculum breakdown of second year Doctor of Pharmacy. We will break down chapters as well as subjects because why do we study those subjects, why do we study those topics, we will discuss that as well as we will discuss future perspective. What will be the use of those topics and subjects? You can link that as well as when you will do a internship, when you will go into further years and when you will do job, how you can use that knowledge, we will be discussing that as well as how you can thrive in exam. We will see that exam tips, which topic has how much weightage, which topics you should more focus on, how that topics will be useful in your further years. We will be discussing that. So over here you can see there are total 6 subjects in your second year. You have first subject that is called as pathophysiology, second is pharmaceutical microbiology, third is pharmacognosy, third is pharmacognosy and phytopharmaceuticals, fourth is pharmacology 1, fifth is community pharmacy, and sixth is therapeutics 1. Number of theory lectures per week will be 3 hours per week. Just for community pharmacy, it's 2 hours per week. Number of practical hours will be 3 for each of them. Just pathophysiology, pharmacology, and community pharmacy, you will not have any practicals. Then number of hours of tutorial will be 1 hour for each subjects. Now let's discuss the first subject, that is pathophysiology. Why you will study this subject? Now, what is the scope of this subject? This course is designed to impart a thorough knowledge of the relevant aspect of pathology of various conditions with reference to its pharmacological application and understanding of basic pathophysiological mechanism. Hence, it will not only help to study the syllabus of pathology but also get a baseline knowledge of its application in other subject of pharmacy. So in this line only you can understand that how it is connected to other subjects in pharmacy, will be useful in your further years. What is the objective? Once you completed this subject, what you should understand, that is you should able to describe etiology means causes of any disease condition, then pathogenesis of the selected disease state, name the sign and symptoms of those disease and mention the complication of the disease. You will be able to understand all this in your curriculum, as well as once you completed the subject you should be able to know all this. What textbooks you will refer? That is a textbook of pathology by Harsh Mohan. We refer that only. It's a best book. You can get every information from that book itself. In which reference book you will refer? Whatever your professor will suggest and that is available in your library, you can refer that. But even this book is really good. I have referred that, Clinical Pharmacy and Therapeutics. We will see chapters now. Now this is a basic chapter, whatever we have studied in 11th and 12th class. Now it will, and also whatever you studied in first year, it will be a little advanced version. Why? Because over here you will be learning pathogenesis, then the abnormalities, then there are multiple pathways, you will learn that. Then inflammation. Again, you will learn pathogenesis, how inflammation occurs, what are the causes of inflammation, its type. You will learn that. And first chapter will be for 5 to 2 marks. The questions you can expect for 5 to 2 marks. Second chapter will be for 5 marks, and they can ask you definition and types of inflammation, that you can be asked for 2 marks. But this second chapter is for 5 marks. The weightage is 5 marks. This whole chapter can be asked for 2 marks, 5 marks, as well as 10 marks. But 10 marks is like really sometimes they might ask, but mostly 2 to 5 marks you can get. Definitions of hypersensitivity, its type, and then the cancer chapter. You will get this cancer chapter has weightage of 10 marks. Types of shock, fifth chapter has weightage of 5 marks. You will get this for 5 marks for sure. And this is a must question, that biological effects of radiation. You will get questions for 2 marks from this chapter, as well as from seventh chapter you can expect to get questions for 2 marks. Eighth chapter, again they can ask you definition and types, that will be for 2 marks. and rest of the complete chapter they can ask pathophysiology of Parkinsonism, that can be asked for 10 marks. So 2 marks to 10 marks you can expect from complete 8 section. So there are from A to B, these are different chapters now. Mm. And in F, angina is different chapter, CCF is different chapter, atherosclerosis is different chapter, then myocardial infarction is different chapter. And when you see pathophysiology of common diseases, then what all, and even in infectious disease, these are all like sexually transmitted disease, HIV is different chapter, gonorrhea is different chapter, UTI is different chapter, hepatitis is in different chapter. So when they say explain the pathophysiology of Parkinsonism, asthma, or hepatitis, then what you have to mention, the points are, there are total 9 to 10 points. That is definition. First is definition, then causes, that is called as etiology, you will be mentioning it as etiology. Then risk factors, sign and symptoms, then pathophysiology, mechanism of action, prevention, then complication, then some sort of treatment. You have to mention all this whenever you get a question. Explain the pathophysiology of any diseases. I hope that's clear. And in assignment, now your professor might allot you any of the topic, or you have to select any of the topic, and from that topic you have to make an assignment. They will allot you how many page, they will let you know how many pages they need for those assignment. References should be included at the end. So that means whatever you have referred, you have to mention it at the end by giving the title as a reference. But ask your professor that in what pattern do they need the reference. That is, you just copy paste that URL, or you need that URL converted into Vancouver style, or whatever book you have referred, you need that to be written in a Vancouver style. So there are websites which converts any URL or any book or any journal you have referred, they can convert that into Vancouver style, so you can use that. Then assignments can be combined presentation at the end of the academic year. Yes, you have to make PowerPoint presentation, you have to present that. 8 minutes will be given and 2 minutes will be question and answering session. And also you have to also you have to submit computer draft copy to your allotted professor. The name and signature of the student should be mentioned. You will be having a cover page. It will be including your title of the experiment, as well as your name and your sign, the professor under which you are doing that, then their name, their designation, and their sign. You will be having that pattern as a cover page. Then the second subject is pharmaceutical microbiology. Why you will study pharmaceutical microbiology? Because microbiology is very essential in pharmacy curriculum. Because the relevance of microbiology to pharmaceutical sciences are more specifically to pharmaceutical industry. Pharmaceutical biotechnology is the logical extension of pharmaceutical microbiology, which is expected to change the complete drug product scenario in the future. So if you want to work in pharmaceutical industry and specifically into pharmaceutical biotechnology, then you have to have the knowledge of pharmaceutical microbiology. And that's why you will be studying this topic. This course deals with various aspects of microorganism, its classification, morphology, laboratory cultivation, identification, and maintenance. It also discusses with sterilization of pharmaceutical product, equipment, media. The course further discusses the immunological preparation, diseases transmission, diagnosis, control, and immunological test. So you will be studying all this into your course. And once you completed your study of the subject, you should be able to understand the anatomy, identification, growth factors, and sterilization of microorganism. You should be able to know mode of transmission of those diseases, causing microorganism, symptoms of the disease, and treatment aspect also. Do estimation of RNA and DNA and thereby identifying the source of those. Do cultivation and identification of microorganism in the laboratory. do identification of diseases by performing the diagnostic test, and appreciate the behavior of motility and behavioral characteristics of microorganism. Textbook, first textbook, that is Vanita Kare and Kishore Busari, Applied Microbiology, Himalaya Publishing House, Mumbai. You can refer that. That's a gold standard book. And also Harsh Mohin is also there. And whatever, if your professor guide you that refer this or that book, you can refer that. Just go whatever they are telling you. Then in syllabus, I will tell you which are the which topics are related to your practical. You will see that in practical also, and which and what is the weightage for your exam. Then first chapter will be asked for 10 marks for sure. Just write it down. You will have that question for 10 marks for sure. Then different types of mode of classification, 2 marks, 2 marks and 5 marks for sure. And they can ask you multiple like bacteria, fungi, virus, explain them. Then you can get that question for 10 marks, but 2 to 5 marks, that's it. Then third chapter, you will be asked like, see till the full stop, nutritional requirements till bacteria and virus, study different type of important media required for growth of aerobic and anaerobic bacteria, fungi. Second, it's the second chapter, differential media till lab culture, again third chapter. Now this all will be asked for 5 to 10 marks, no 2 marks. You can't expect anything from 2 marks because it's a heavy chapter. That's why 5 to 10 marks. Again, fourth and fifth chapter will be for 5 to 10 marks. You can expect it for 5 to 10 marks, and they can ask you some definition and types for to explain that for 2 marks. Then sixth chapter you can get that for 2 marks, 5 marks as well as 10 marks. Seventh chapter is also same, but mostly you can get that for 5 to 10 marks only. But these in seventh chapter you can see significance of toxins in active immunity, immunization program, and importance of booster dose. You can get this question, immunization program and importance of booster dose, can be for 5 to 10 marks. Diagnostic test, you can expect this for again 2 marks, 5 marks and 10 marks. They can just tell you what is ELISA test, explain, or for each and every test you they will mention, they will have a question, and in that question they will be giving give the definitions of 2 3 tests given over here, like ELISA test, western blot test, southern blot test, PCR vidal. So you have to mention definition and little bit about them. Then you will get that for 2 marks, or otherwise you will have to explain everything, that will be for 5 marks, not more than that. Then study of malarial parasites, again that is also included in 8th chapter. That question will be for 10 marks, guys. Then ninth chapter, again it will be for 5 to 10 marks. Mostly it will be for 10 marks because there are assays. Then standardization of vaccines and sera, so this will be for 10 marks. Then study of infectious diseases, again this every diseases like typhoid, tuberculosis, these are separate different chapters, so that will be asked for 10 marks, complete 10 marks. Or they can just ask you which test or how you will perform any microbiological test, the procedure, for 2 marks. They can ask a little bit of that, little bit part of that for 2 marks. And in practicals, see, if you see that 1 star, that is minor experiment, and the 2 star, those are major experiment. The only thing I will tell you, while performing practical, when your professor is performing this practical and when they are guiding you, please pay attention when they are teaching you, because because during examination you will have to perform all those, and a mistake on just a one step uh, can hamper your complete results, as well as it can give a zero results. So please pay attention while you are learning these practicals. Please pay attention on these assays. It's a huge procedure, it will take a lot of time, and in annual exam you will be having this. Then During that time you should not get confused, you should not forget any steps, and because it will hamper the complete results. So pay attention while performing. And assignments that is included in uh, microbiology, that is you have to visit some pathological laboratories and because to study the equipments and instrument used in those labs, as well as you have to visit milk dairies to study the microbial activity, how the pasteurization method take place, and your college will arrange that. Then third assignment, you have to report, means you have to make a report in word format about the recent microbial techniques developed in diagnosis some of the common diseases. If you take typhoid, TB, uh, malaria, if any microbial techniques have developed recently, you can refer Science Direct, Sci-Hub, refer research article on those sites, and then you can make this report. As well as the second also, latest advancement developed in identifying, cultivating and handling of microorganism. Any one of them you have to do, or maybe you have to do both of them, it depends on your professor. So for that you can use those sites. And again, the same format whatever we have discussed earlier. For now, for this the examination practical scheme is: synopsis in sessional will be for 5 marks, and in annual it will be for 15 marks. Major experiment 10 marks, and in annual 25 marks. Minor experiment in sessional 3 marks, annual 15 marks. Viva in sessional 2 marks, and in annual 15 marks. Then in sessional it will cover 20 marks, 10 marks will be for your journal, and in annual it will be for 70 marks. You will get 3 hours in sessional and 4 hours in annual exam to perform the practical. Your third subject is pharmacognosy and phytopharmaceuticals. Now this is very interesting subject. Now why we will study this subject? Because this subject has been introduced for the pharmacy course in order to make the student aware of medicinal uses of various naturally occurring drugs, its history, sources, distribution, method of cultivation, active constituents, medicinal uses, identification tests, preservation methods, substitute and adulterants. You should have the knowledge of this. Why you should have knowledge of all this? Because if you want to pursue career in industry, and if you want to pursue career in industry specifically in producing herbal products or any ayurvedic product, you have to do formulation of all those. Then you should have knowledge of all those. That's why the subject is included into your curriculum. And once you completed this subject, you should be able to understand basic principle of cultivation, collection, storage of crude drugs, know the source, active constituents and uses of crude drugs, and appreciate the application of primary and secondary metabolites of plant. Textbook you can refer is Pharmacognosy by C.K. Kokate, Gokhale and A.C. Purohit, and in reference book whatever your professor is guiding you to. Then we will see now topics that is included. First, second and third topic will be for 2 marks. Introduction, definition, classification, this will be for 2 marks. Then fourth chapter, fifth chapter, sixth chapter will be for 5 marks. As well as they can ask you um, study the cell wall constituents and cell inclusion for 2 marks also, and they can combine all this and ask you this fifth chapter. You might get this fifth chapter combined with fourth chapter, and they can ask you for 10 marks. Seventh chapter is for 5 to 10 marks, and some of the part like definition they might ask you for 2 marks, but it's majorly for 5 to 10 marks. Study of natural pesticides, they can ask you for classification for 2 marks, or rest of the things will be for 10 marks. Detailed study of various cell constituents, 2 marks to 10 marks. 10 chapter will be for 5 to 10 marks. And detailed study carbohydrate contained drugs, there are total 11 drugs. Now those 11 drugs will be selected by your professor, they will let you know, and that will be for 10 marks guys. Then 12th chapter will be for 10 marks, 13th chapter will be for 10 marks, then 14th chapter will be for 2 marks as well as 10 marks. 15th chapter, 14 and 15 chapters will be for 2, 5 and 10, all of them they can ask you in any way. Then different modes of adulteration of crude drugs. They can ask you just one type of adulteration or just enlist the type of adulteration for 2 marks as well as for 10 marks. A huge question. And in practical, see, this first two is our different practicals: introduction of pharmacognosy laboratory and experiment, study of cell wall constituents and cell inclusions. Then these are then the rest from third to 17 you will have the same, just the plant will be changed. Macro and powder and microscopic study of datura to podophyllum, same. Then determination of iodine value to acid value. Then chemical test for acacia to chemical test of gelatin. Now in this rest everything is same, just the identification part is there. And for that, how you can score complete out marks, because in rest of the things the professor can deduct your marks based on because we don't just copy paste whatever it is written in the journal manual. We write it from our own words, so through that your marks can get deducted, half marks, 1 marks, but in identification you can score out marks, it's in your hand. So how you can get that? While observing under microscope anything, you will have to identify that is this plant datura, or is this plant podophyllum or ginger, or whatever you're seeing in the slide. Then during that, what you can do is, whatever different thing you are observing in that slide, okay, I can see the star shape, or the cell wall is looking like a brown lining, or I can see the pink globules. Then you can differentiate that slide, and if you find two slide that have common features, then take both slide and try to find something differentiated in both of them, and learn that, so that it will be useful during your exams to identify. If you see a star shape, you can quickly tell, okay, this is that plant. You can get out marks over there. Now we will go to our fourth subject, that is pharmacology 1. Why we will study pharmacology? Let me tell you. PharmDs are known because of we have studied pharmacology and pharmacotherapeutics. Why we are differentiated from other pharmacy courses? Because of these two subjects, basically. And also because of the because of these two subjects, as well as the depth of every subject we have other than the rest of the pharmacy courses, we are known because of that. Then why we will study this subject? What is the scope of this subject? Because it will provide an opportunity for the student to learn about drug with regard to its classification, pharmacodynamic and pharmacokinetic aspects, adverse effect, uses, dose, route of administration, precaution, contraindication, and interaction with other drugs. And in this subject, apart from general pharmacology, drugs acting on various systems, you will learn that. As well as once you complete this subject, you should be able to understand pharmacological aspect of those drugs falling under the chapter. Chapters mean whatever those disease and whatever the systems are included. You should be able to understand those pharmacological aspect. Handle and carry out animal experiments. Appreciate the importance of pharmacology subject as basis of therapeutics, and correlate and apply the knowledge therapeutically. Now over here you can see handle and carry out animal experiment, but in pharmacology you have seen there is no experiment. Why they have written this? Yes, there is no experiment according to PCI, but our college still had practicals for pharmacology. We have to give those practical exams too. We perform animal experiment, that is examine the antihistaminic histaminic properties on chicken ileum. We have to do those experiments. So it will again vary from every institute. Textbook you should refer the gold standard book, that is KD Tripathi. That's the best book. You will get everything. No need to go anywhere. But still, if you want to refer, then C option, that is Rang and Del. You can refer that. And in reference, you can refer Goodman and Gilman. That's really good book. Now we will see the topics. First is general pharmacology. So you will have introduction, then what is pharmacology, Pharmacology means pharmacokinetics and dynamics. You will study that. Factors affecting the drug effect, drug toxicity, preclinical evaluation, drug interaction. This you will get this for 2 marks, definition of each of them, as well as you can get combined pharmacodynamics, kinetics, route of administration, scope of pharmacology we just saw now, then enlisted drug interaction or little bit explained drug interaction. You can get this for 2 to 5 marks, but majorly for 2 marks. Then this second, pharmacology of drugs acting on ANS, cardiovascular system, central nervous system, respiratory tract, hormones and hormones antagonist, and pharmacology of autocoils and their antagonist. These have different types of drug classification you will have under those, as well as you will have some conditions, like okay, over here you can see myasthenia gravis condition, Parkinsonism condition, CHF. Then so whenever they say pharmacology for each and every drug, now adrenergic, anti-adrenergic drugs, so under them you will have a huge classification of drug. What are the drugs included in adrenergic drugs? So you will have a classification, and under that each classification you will have many kinds of drugs. Now for each and every drug you will have to mention as well as study and write it in the exam all these points, that is classification, mechanism of action, pharmacokinetics, pharmacodynamics, adverse effect, contraindication, therapeutic uses, interaction, dose, route of administration, and over here it is not written but definition also. So 10 points are there total. You have to mention for each and every drug. It's going to be huge, but it's kind of interesting if you study. Then our fifth subject is community pharmacy. Why you will study this community pharmacy, I will tell you. If you want to open your own business of community pharmacy, then you should have the knowledge how you will dispense, how you will stock up the product, how will you respond to minor elements, and how will you provide safe medication, safe patient counseling, health screening services, and how you will improve the patient scenario and their health care. So so because of that, this subject is included, and the objective is you should know pharmaceutical care services once you complete the course. Then know the business and professional practice management skills in community pharmacy. Do patient counseling and provide health screening services to public in community pharmacy. Respond to minor ailments and provide appropriate medication. Show empathy and sympathy to patients and appreciate the concept of rational drug therapy. The textbook and reference book, you should refer whatever your professor is guiding you, because sometimes you may not refer from whatever it is given under this. Then there is a special requirement. There are no practicals, but it's like kind of internship. Do training in community pharmacy for 1 to 2 months, I guess. We have did for 1 month. In community pharmacy, maybe your college has signed MOU with some of the community pharmacy, or you have to go on your own. Then convince the community pharmacy head that you want to do a training over there. Then take a letter from college and submit it to that head. Then they will sign on every day, that every day you have attended, every day your attendance will be there, as well as they will sign each and every day. Then you will have to mention what work you have performed in that day. So the for official layout will be like that, and you will have to perform the activities over there. That is, you will have to learn how they stock up the products, how they take the orders, how they dispense, how they patient counsel. You will have to do all this, you will have to observe all this and learn all this. And then the second requirement is you will have to learn BP apparatus, glucometer, peak flow meter, and apparatus for cholesterol estimation. During annual time, you will have to perform all this. Synopsis will be there. Again, synopsis will be based on whatever training and whatever you have studied BP apparatus to cholesterol estimation as well as from theory, that will be asked. Major experiment will be counseling patient with specific diseases. Emphasis should be on counseling, introduction, content, process and conclusion. I will explain you this. Minor experiment will be you will have to measure your BP, CBG or lung function. Then prescription analysis, you will have to find the drug interaction. What drug interactions you have observed. They will give you a layout, some kind of sample questions. You will have to find the drug interaction in that, as well as you have to tell the management will be replace the therapy, modify the therapy, how you will you may have to change the dosage or frequency or completely change it up like that. Then viva voice will be there. It can be completely anything from your entire syllabus. As well as we have said major experiment, in that you will have to act like now you are going to counsel the patient with certain diseases. Like your fellow classmate will be there as a patient, how you will counsel them on diabetes, how you will tell them okay this diabetes is like this, then how you should consume the drugs. If the dose is missed, you should not repeat. This is the tablet in morning, this is at night. So all this will be, you will be doing that experiment as an act. Now we will see the topics. First will be for 2 marks, 5 marks, 10 marks, all of them. Second chapter will be for 5 marks, as well as they can tell you selection of site, space, layout and design. To draw that, it might be for 2 marks also. And then prescription. Now the third chapter will be for 10 marks for sure. Fourth chapter, they can ask you combinedly like ABCVD analysis combinedly, that will be for 10 marks. Otherwise this chapter is for 5 marks. Then pharmaceutical care, again 5 marks. Patient counseling, now this will be again for 2 and 10 marks. Seventh chapter will be again for 2 and 10 marks. Every chapters will be for 2 marks. They can ask any definition or type or classification from that. So every chapter uh, you can think that each and every chapter is for 2 marks. If you studied for 10 marks, then you can write easily. Then eighth chapter is again for 2 to 8 chapter is again for 2 to 5 marks. Then 7 chapter will be for 2 and 5 marks. Then the 10th chapter, because you will have to study the tuberculosis, hepatitis, typhoid, these all diseases, to AIDS and gonorrhea. Then this will be for 10 marks, as well as WHO definition, that will be for, and those guidelines for those patients, that will be for 5 to 10 marks. Then balanced diet treatments, it will be for 5 marks and 2 marks. Family planning and role of pharmacist will be for 2 and 5 marks. Then chapter 11th will be again for 10 marks and 5 marks. And in this, pain is very important. You will definitely get question on pain for sure. So study that really well. And in 12th chapter, it will be for 10 marks. And even 13th chapter will be for 10 marks. Our sixth subject, that is Pharmacotherapeutics 1. Why you will study this subject? As I have told you during pharmacology, the same scope, that is for therapeutics, because it's a basic skill, because we are going to work in a clinical setting. We should have knowledge of pharmacotherapeutics. This course is designed to impart knowledge and skill necessary for contribution to quality use of medication. And who we are medication expert. That's why we should know how to use this medicine appropriately. These chapters cover briefly pathophysiology and mostly therapeutics of various diseases. Therapeutics means it's related to drug. How that drug therapy will be followed. You will be studying that. And this will enable you to understand pathophysiology of common diseases and their management alongside. And once you completed this study, you should be able to know pathophysiology of selected disease and the rational drug therapy for those, then therapeutic approach to management of those diseases, the controversies in the drug therapy, The importance of preparation of individualized therapeutic plan based on the diagnosis and needs to identify the patient specific parameters relevant in initiating drug therapy and monitoring the therapy during the time course of clinical and laboratory indices of therapeutic response as well as adverse drug effect. The rest all F to J is again the copy pasted version. Then then for as a textbook you can use both, but we have used pharmacotherapy of pathophysiological approach by DiPiro. It's an based book. You have everything. You will get everything included in that. And as a reference book, actually DiPiro itself look like a reference book, but as a reference book you can use any one of them that is available in your library. But you can use applied therapeutics, the clinical use of drugs, if you have every book that is available in your library. And in topic you will have certain systems. You can see cardiovascular, respiratory, endocrine, some systems, and in those whatever disease conditions are there, they have included those, and you have to study the therapeutics of each and every diseases. Then general prescribing guidelines for pediatric, geriatric, and pregnancy and breastfeeding. You will get this question for 5 marks. Third chapter is for 5 marks. Ophthalmology, glaucoma, conjunctivitis. Fifth chapter is again for 5 marks, and sometimes they can ask you for 10 marks. Like it's a rare, but yeah. And the fifth chapter, introduction to rational drug use, 5 marks. So third, fourth, and fifth will be for 5 marks. Then the first and second cardiovascular system, respiratory, and endocrine system. These all chapters will be asked for 2 marks, 5 marks, and 10 marks. Anything can be asked. It will be according to your what chapters are included in your first sessional, second sessional, third sessional. So they can ask you just hypertension, give definition, classification, and the classification of the drugs, the therapeutic layout, or the therapeutic regimen, how you will do that. So they can ask you for that for 2 marks. Then for 5 marks they will tell you, explain the pharmacotherapeutic approach for hypertension. So you have to write it accordingly. Write 8 pages, 10 pages for 10 marks, then 5 to 6 pages for 5 marks. So it will be like that. You will have to cut short according to the marks. So these all will be for 5 to 10 marks. Just I will let you know if anything. You can get hormone replacement therapy and oral contraceptives for 5 marks, as well as drug induced pulmonary disease for 5 marks. I'm letting you know all this because of based on my experiences. Based on my experiences, as well as our professor let us know that how much the weightage every topic holds. During study you will understand how much those topics hold the certain weightage, as well as we have referred many question papers from different universities. So through that I have understood this, and it's my personal experience. Again, it can vary, everything can vary according to your institute, according to your professors. Pharmacotherapeutics one will be having practical, that is you will be having hospital posting in a particular department, whatever your college is allotting you. Then you will have to collect minimum 20 cases from all those allotted departments, and at the end you will have to present, or they will let you know when you will have to present in every week or every month. Whatever cases you have taken, you will have to present, have to do a presentation on that. And the last, that is assignment, that will be, that should be written assignment. Again, our professor let us know that we have to type it in a word, and we have to submit that draft copy. Then what the assignment should be: a recent development in drug therapy of various disease. Any disease you can pick up, or your professor might allot you. So on that disease whatever recent developments in drug therapy is there, you have to find out. And how you can find out, as I have already tell you, research paper, then journals that is present in your library, you can refer that. Science Hub, Science Direct, all those sites you can, PubMed, you can refer all those to get an articles. And from 1500 to 2000 words, you have to make assignments for each of them. and and the format of assignment should be same as whatever we have discussed for other subjects too. And the practical examination scheme is same as like other subjects. I hope that's clear. And if you have any doubt, you can comment me below. I will answer that for sure. As well as you can message me on my Instagram and LinkedIn. I will answer that for sure. And email me also your doubts. And if you find this video insightful, please like, share, and subscribe. Bye bye.